My name is Bright Simmons. I'm the Chief Strategist of mPedigree, which is now currently based in Ghana and Hanover, United States. We're the only organization in the world that has developed a comprehensive approach to the very massive job of fighting counterfeit drugs in the world. So let me tell you a little bit about counterfeit drugs. Counterfeit drugs are medicines that look just like the real thing. They've got a labeling, sometimes you cannot detect between these kind of drugs and the real things. But the real things are things that can do good things for you, that can save your life if you are ill, or whatever it is your lifestyle aims or goals that you seek to achieve. Real drugs can help you do that. Counterfeit drugs can't. If you seek and you take a counterfeit drug, well, if you're very lucky, it might not do anything at all. But if you're not, then you could actually die. And in 1995, in a country called Nigeria in West Africa, as many as about 3,000 kids died from taking counterfeit vaccines. And this was to protect them against polio. It ended up killing them. About 50,000 of them, 3,000 of them died. The rest of them were either maimed or the very lucky ones weren't protected from polio. So counterfeit drugs are a big problem around the world. The WHO, which is the World Health Organization, estimates that a third of all the drugs that are sold in developing countries are actually fake or counterfeit. That is, they are not the real thing. They look like the real thing. There's no way an ordinary person could tell that they are counterfeit. But when you take them, bad things happen to you. In Lagos, that is Nigeria, the commercial capital of Nigeria, in 2001, Interpol, that's the International Police Organization based in Lyon, France, conducted a survey and discovered that not 30%, 80% of the drugs were actually counterfeit. So that's a big problem. How do you solve this? There's a multiplicity of reasons why counterfeit drugs are getting to become such a big problem around the world. Regulators, those people who are tasked with a job of trying to prevent counterfeit drugs, often do not have the resources that they should have because of the fact that we don't make drugs in the same place due to the fact of what we call supply chain proliferation. The drugs that are supposed to be made in Malaysia will be designed in Taiwan, the marketing will occur in Budapest, and then the drugs will be sold in the United States. Eventually, they might be resold in Africa. So because of that, it becomes much more difficult to police the supply chains. And the fact also that drugs are sold in legitimate supply chains. Drugs outlets, they are manned by health professionals, and you can trust your health professional. So you never expect that you're going to be served something that can do bad things for you. So because of all that, counterfeit drugs are very hard to solve. And the way we have attacked it is to create a pivot around which stakeholders, people who are concerned about counterfeit drugs, can interact, and then by so doing, help solve the problem. And the pivot we've created is technology, user-friendly, cheap, actually free technology. And the main technology we are using is mobile phones. So what we've done is we've gone to the manufacturers and we've convinced them that, one, they are losing market share to counterfeiting. Counterfeiting means that they are selling less than they will otherwise sell. We've then convinced the telecom operators that there is a market for allowing SMS, which is the one component of the GSM framework, to expand. And so the manufacturers then put on codes on the products that they sell, the medicines that they sell. And when a consumer buys a piece of medicine, a pack of medicine from a shop, they unveil the code by scratching the scratch panel to reveal the code. They then send it as an SMS to a number that we've widely advertised in Ghana. And once this number has gone into the database through this number, the database compares it to all the genuine numbers or codes that were generated for manufacturers. And if there's a positive comparison, it means the medicine is correct medicine, and therefore they can take it. If not, it will communicate it into their phone in 3 seconds or even less, so that they know that the medicine they are taking is the right medicine or not the right medicine. The way it also works is that if there is a heightened alert, that is, if a lot of people are sending fake codes, which means that they are buying counterfeit medicines, the regulator, that is the government organization, whose job it is to protect people from fake drugs, will be alerted automatically. So we are not only helping consumers to detect between fake and genuine medicines, we're also giving the regulators intelligence and information about which part of the country, or as we say, which part of the supply chain is most at risk. And therefore, this is a very comprehensive approach to solving the problem. We work with telecom operators, and all the 4 telecom operators in Ghana are our partners. We work with manufacturers who make the medicines and put on these codes. Obviously, we work with retailers, in this case pharmacists, who are actually selling the medicines out. And we work with the Consumers Association of Ghana to increase awareness and to sustain the advocacy project. We're actually moving out beyond Ghana now. We're hoping to replicate in Nigeria last year, that is 2009. Eventually, we also hope to go to India, maybe by the end of 2009. In Nigeria, we've developed very strong stakeholder partnerships. In India, we've just begun. But we're very sure that we're going to be successful in India just as we've been in Ghana and Nigeria. And if you go to India, then obviously we'll go to Sri Lanka, Bangladesh. So this is a global movement. This is a global struggle. The problem is complex and you can't solve it in only one country because sometimes the medicines come from overseas. It's very difficult then to only focus on one country because what will happen is that the fake medicines will filter in through the borders. So we have to go global. It is part and parcel of what we do. And therefore we have a global vision now. And we're hoping for resources, we're hoping for partnerships with telecom operators, with technological companies, with funders, people who have resources that they can give to us. And the beauty of our model is that because it is also financially self-sustainable, it is viable financially. And that means that when the manufacturer, because he's losing market share, because he's interested in liability, if somebody takes a fake drug and dies, he cannot tell the difference between that fake medicine and your real medicine. That's what we tell the manufacturer. So they are aware of the impact on them in liability terms, and also the fact that they are losing money that could have come to their business to counterfeiters. They are prepared to pay for the service, and they pay not because they do care about their consumers and all that, but even beyond that, they understand the business case for it. If they weren't using our model, maybe they will use holograms, and holograms don't work because no matter how sophisticated you can make the hologram, if the counterfeiter makes something that looks like it, the consumer has no way of distinguishing between the genuine hologram and the fake hologram. So in this case, they understand that holograms will cost them a certain amount of money and will fail to do the job. So if we are giving them as an alternative that not only does the job, but also come at a cost that is reasonable, the business proposition to them is clear. So it's not just a social proposition. To some of our partners, we make business propositions. We make clear-cut commercial propositions. And then to the wider public and to our consumer partners, to our activist partners, we emphasize the social partnership. And for that reason, when we go to investors, social investors, for instance, we explain to them that you're not only helping make a difference in the world, but also you're going to get your funds back. If you put in $1, in 3 years, you get maybe $1.50 back. And so this is a clear-cut case of social business principles transforming the society from within. Also, we like to say that we are not a service provider. We don't provide a good, we don't provide a service. We build an infrastructure. And I think one of the problems the world is facing now is that there's a lot of focus on providing goods and services to meet certain defined needs. But most of the emerging needs, the new needs of our society that are coming up cannot be solved by having a product and a service approach or perspective. We need to think in terms of infrastructure because the needs are fragmented across various stakeholders. And therefore, the only way you solve such problems is to provide an infrastructure around which stakeholders can band together to solve problems. And this is the new model that are going to be used to solve the emerging problems that are affecting us. Global warming, narcotics, peddling, human trafficking. These are complex problems. And you cannot solve them by looking at them in terms of what services will meet these needs. No. What infrastructure can be built that will allow multiple stakeholders to interact and therefore allow goods and services to merge to serve a multiplicity of needs. So we are building an infrastructure. We are not providing a good and we are not offering a service. And that we think is our theory of change and our biggest contribution to improving the state of the world. This new thought leadership that we are offering. So we will urge potential supporters, partners, potential funders to look critically at what we do. And if they feel there's something that they can offer that can be of value to this enterprise, we very much appreciate it. Thank you.